How you doing?
I'm good. How are you?
I'm great. So what brings you here?
Well, I've noticed I've had the past 2 to 3 days I've been experiencing some chest pain. I first kind of started experiencing it while I was shoveling the driveway with snow, and I, had this like a chest pressure, or I don't know how to describe it. It hurt, and I had to go. I started sweating, and I had to go inside and get a glass of water and sit down before 15 minutes later before I felt better and could go back out. So that's what brings me in today.
Okay. Did you break out into a sweat when this happened? Okay.
I did, yeah.
Has this happened before?
It's happened like once or twice before. In the summer, I noticed it when I'd be doing yard work. I kind of get a little bit more sweaty than I normally would, or just I kind of get a little bit of chest pain, but I would sit down for 5 minutes and it quickly resolve. So.
Okay. Do you have high blood pressure?
I do.
Okay. Are you diabetic?
No.
Okay. And do you have high cholesterol?
I'm kind of borderline.
Okay. You're on Lipitor. I see it on your list.
Yeah, I would say
so
that.
So how long have you been on Lipitor?
A couple years.
Couple years.
Yeah.
So your family doctor put you on that?
Yeah.
So you must have had a higher cholesterol if they put you on that a few years ago. Anybody in your family has had heart problems?
My dad, when he was in his early 50s, he had a pretty big heart attack and got a stent as a result.
Okay.
So.
And he's doing okay now?
For the most part, yeah.
Okay. All right. And do you smoke?
I do, yeah.
Okay. How much do you smoke?
About a pack a day.
About a pack a day. Do you drink at all?
Socially. So.
Okay. All right. Any surgeries in the past?
Just getting like my wisdom teeth out.
Okay. So no major surgeries. Okay. And all right. Wonderful. Let me check you out. See how you're doing. Okay. So pulses are normal. Heart rate looks to be about 70 beats a minute or so. Let's listen to our heart. Okay, heart sounds are normal. No murmurs. Okay, breathe in and out. Breath sounds are normal. No rales, ronchi. Pulses are all equal, 2+. Okay, no edema. All right, let me look at the EKG that they did. Okay. All right, so EKG looks a little bit off. Okay, there are some changes which are bothersome. Okay, so your discomfort is what we call as angina. Okay, so typically if you have a blockage to your coronary arteries, when you exert yourself and you do something strenuous, your heart needs more blood flow, and you're sort of restricted in that, and then you can get this discomfort, which usually goes away when you rest. So that's what we call as angina. So that's what I'm hearing. Okay. So just based on your history, you have a family history of heart problems, you've had a high cholesterol, I would think you are at increased risk for having blockages. So the likelihood is fairly high. Okay. So what I would like to do is get you started on some medications first. Okay. So we're going to get you going on some aspirin. So all you have to do is take the 81 milligrams, the baby aspirin, the enteric coated. You can just pick it up in any over-the-counter pharmacy. Okay. Take one a day. We're also going to start you on a beta blocker. We'll start you on a pill called metoprolol. We'll put you on about 50 milligrams twice a day. All right. Continue the cholesterol pill. So the choices we have to make is, do we do a stress test, or should we go to the gold standard test, which we call as a heart catheterization? Okay. Since you've been having chest discomfort at fairly low levels of stress, it's not that you exerted yourself all that much, and this has all changed so quickly. I would suggest we skip the stress test and go straight to heart catheterization. The reason being, you do the stress test and you see something, you're going to end up with a heart cath anyway. And if we don't see anything on the stress test, which sometimes can be negative and there can really be a problem going on, we're not going to believe anything on the stress test. We're going to go straight to a heart cath. So I suggest we go straight to a heart cath, get to where the problem is. What we'll do is we'll go up from the wrist or the groin up into your heart, use a thin catheter, inject dye into the blood vessels that supply the heart with blood, and see if there's a blockage. We usually do this at the hospital. And if there's a blockage, then often we can fix it at the same time. The risk of the procedure is fairly small. I think any serious complications are like 1 in 1,000. Okay. You could have some bleeding complications. That's maybe about 2%, but that's still, I think, a fairly small risk to take to get to the bottom of this problem. Okay. So we'll schedule this for sometime next week. We're going to get some blood tests to make sure everything's fine. Okay. And we'll go from there. And my nurse will give you instructions as to when the procedure is, where to show up, when, and all that.
All right.
Okay. You have any questions? Anything I can address for you?
Is this like, do I have to stay in the hospital overnight for this procedure?
It
or?
depends. If everything's fine, you get to go home the same day. Okay.
Okay.
But supposing there's a problem, a blockage, and if we have to fix something, there's a good chance you'll have to stay in the hospital overnight.
Okay.
Now, if it's fairly low risk and we fix it very easily, then you may even go home the same day. Now, there are times when we do this procedure and a more extensive blockage may require bypass surgery, things like that, then you may have to stay in the hospital. Okay. Even if we do an angioplasty or a stent, the complication rate is fairly low. There's probably less than 1% chance that we'll get into trouble that requires anything else done.
Okay.
We wouldn't know that till we actually do the procedure. All right?
All right.
Okay. So let me tell them what to do. So can you go ahead, start her, give her a script for metoprolol, 50 milligrams twice a day. Inpatient instructions say she needs to be on aspirin 81 milligrams once a day. She could get that over the counter. Continue the Lipitor that she's on. Order a CBC, a BMP, get a lipid liver panel. That's all before she has this done. And then just call the cath lab and get a time set up for her and let her know when and where to come. And then we'll take it from there. Okay? All right.
All right. Thank
We'll
you
see
so
you
much.
in a few days. All right?
Sounds good. Thank you.
Yeah.